Your friendly neighborhood pain in your ass is back. Hi, I'm Shelly with Shelly's Nursing Review. And so we are finishing up a little bit about this VFIB, this horrible strip, right? So we talked about the causes. We said an MI, a pulmonary embolism, a pneumothorax. We said electrolyte abnormalities. We said that number one was severe oxygen deprivation. We talked about toxins and overdoses, whether they were legal or illegal. We called it the H's and the T's of VFIB. And you have all of these here. Hopefully your little ass was taking notes on your cardiac packet. For those babies in my class, you already know what it is. Now we got to fix our patient. So come with me. Oh, you ain't know I could dance? Oh, sorry, I get distracted. Okay, here we go. Your ass walks in, VFIB on the EKG. You better be trying to call a code to get some help, because you know you can't do every damn thing by yourself. But you see this on the EKG. Your first nursing action, and don't get this wrong, don't get confused by walking up on a person who's collapsed. That would be a different kind of what do you do first. If I walk up on a person who's collapsed, you already know how this is going to go. Annie, are you okay? And then I'm going to be feeling for a carotid pulse, and then I'm going to be, doing my thing. No. I just told you, you have VFIB on the EKG. And a lot of you are sitting in your bed or your couch or your chair thinking, oh, I got this, VFIB, DEFIB. Well, that's a cute rhyme, but that ain't really what you're doing. Unless you walk into the room with paddles, how your ass gonna be like, hey, my name is Shelly. I just came to DEFIB your ass. It ain't gonna work. So let me tell you what really happens. You walked in the room. This patient is in VFIB on the EKG. Your first nursing action is get your ass some help and start pounding on the chest. This is the key right here. CPR. Start pounding on their chest, child. 30 to 2. Make sure they're flat. If you got one of them little cutesy, expensive buttons on your bed, put the CPR button to get the bed to deflate and be flat. If you don't, put that backboard up under that patient and let's get to rolling. Now, you told somebody to grab your defibrillator. Like I said, you didn't walk in the room with shit. When they grab the defibrillator, the first number that you're going to be using, and you'll use higher doses later, 200 joules. This is where we start. 200 joules. After the all clear, I will be linking a wonderful video on this, how to kind of get your life together so you don't be messing folk up. But let me just warn some of y'all who might be clueless in Cleveland. Here we go. If I hear that you were defibrillating a patient with asystole or pulseless electrical activity, or anybody with a pulse, I'm going to come shank you in your kidney, punch you in your throat, remove your eyelashes and eyebrows one by one, and then some more things I can't say on this video. Don't do it. Do not defibrillate asystole, pulseless electrical activity, or anybody with a pulse, except your ex who cheated. I'm sorry, I don't know where this is coming from. I'm going to try to redirect. Now, what should you do with those people? CPR, Epi, IV push, do a little something like that. Same dose as the patient we're about to treat. Now, come on now. Shit, I'm tired. I got to go. I got to get to church and pray about y'all. Now, so here we go. You did call a code, CPR, defibrillate per instructions, and the link I'm going to hook you up with. I'm even going to hook you up with the link for CPR because some of y'all don't even know that. CPR times 2 minutes or 5 cycles. Same shit, different day. Alternate with your defibrillator. Alternate it, okay? You got me? You feeling this? Okay, good. Now, IV push epinephrine. Don't screw this up. The dosages of epi are so different depending on what you're using it for. We can use it for anaphylaxis. We can start an epi drip. No. We're doing a code. The dosage for epi in a code, don't mess this up. Write it down. prick your finger and bleed on it, spray some perfume around it, put some stripper glitter all over it, whatever you got to do to highlight this shit other than just a highlighter. 1 milligram in 10 cc's or 10 milliliters, a 1 to 10,000 concentration, and you can blow that puppy every 3 to 5 minutes. Epi is a vasopressor. It's going to cause vasoconstriction. If I was on the street, you know, back in Kinsman, Garden Valley, whatever, if I was on the street, this would be called adrenaline. That's exactly what the hell it is, but it is a pharmacological version of adrenaline. It's epi. It's gonna get you crunks. Hopefully it'll wake this fool up with a heartbeat and a blood pressure. That's what this is. Again, a vasopressor. Just one example. We've got a million of them. Now, as the code goes, if this is just getting worse, we are alternating our CPR with our defibrillation, and we may even give amiodarone. Remember, this is a cardioversion medication that the patient might benefit from. In that event, it would be 300 milligrams. Now, I hope your little behind learned some things today, because I ain't got time to sit here and play with y'all all day long. I really got to get gone, and peace out. Deuces.